Hello guys, welcome back to my channel, and here we are learning about the anatomy of ureter. If you haven't subscribed yet, please subscribe and press the bell icon. Now first introduction. Ureters are a pair of narrow, thick-walled muscular tubes which convey urine from the kidney to the urinary bladder. And now its location. They lie deep to the peritoneum, closely applied to the posterior abdominal wall in the upper part and to the lateral pelvis wall in the lower part. And now its dimensions. It is 25 centimeter or 10 inches long, and its diameter is 3 mm. Now the courses in abdominal. The ureter begins within the renal sinus as a funnel-shaped dilatation called renal pelvis. The renal pelvis receives urine from the major calyx. The point at which the renal pelvis narrows to form ureter is known as uretopelvis junction. The ureter passes downwards and slightly medially on the tip of transverse processes and psoas major muscle. After arising the uretopelvis junction, the ureter descends through the abdomen along the anterior surface of the psoas major. Here the ureters are a retroperitoneal structure or located behind the peritoneum. At the area of sacroiliac joint, the ureter crosses the pelvis beam, thus entering the pelvis cavity. At this point, they also cross the bifurcation of the common iliac arteries. Now courses in pelvis. Once within the pelvis cavity, the ureters travels down the lateral pelvis walls. At the level of ischial spines, they turn anterior-medially, moves in the transverse plane towards the bladder. Upon reaching the bladder wall, the ureter faces its lateral aspect in an oblique manner. This creates a one-way wall where high intramural pressure collapses the uterus, preventing the backflow of urine. Now relations. Outside the kidney, anteriorly left side, second part of duodenum and renal vessels, and right side, renal vessel, jejunum, peritoneum and pancreas, and posteriorly psoas major muscle. And abdominal part of ureter, anterior relation, right side, duodenum, ileocolic vessel, peritoneum, right colic vessel, gonadal vessel, terminal part of ileum. And now left side, sigmoid mesocolon, peritoneum, sigmoid colon, left colic vessel and gonadal artery. Now the relation of pelvis part of ureter is posterior relation, internal iliac artery, sacroiliac joint, internal iliac vein and lumbosacral trunk. And lateral relation, superior vessel artery, inferior vesical artery, obturator nerve, obturator artery, obturator vein and medial rectal artery. Now its blood supply. Upper or abdominal ureter. The arterial branch stem from the renal and gonadal artery, abdominal aorta, and common iliac arteries. And pelvis or distal ureter blood supply is arterial branch common from the vesical and uterine arteries, which are the branches of the internal iliac artery. And now nerve supply, sympathetic by T10 to L1 and parasympathetic by S2 to S4. Now clinical anatomy. First is uratus collis. The pain in this condition comes in waves and is intense, beginning in the small of the back and usually spreading in the lower abdomen, external genitals, and inner thigh. And second one is uratus stone. The uratus stone is liable to become impacted at one of the side of normal contraction of the ureter. Now posterior relation, psoas major muscle and genitofemoral nerve. Now medial relation, right side, inferior vena cava and left side gonadal vein.